the region of the neck. So we know this is the margin of the mandibular or the base of the mandible. This is the clavicle. Posteriorly here we have the trapezius muscle, and this is the anteromedian line. So this entire region is the neck, divided into an anterior and a posterior by this sternocleidomastoid. So in this anterior triangle we have first this muscle, that is the sternocleidomastoid. Then we have this muscle which we refer to as the superior belly of omohyoid. Okay. This one is the superior belly of the omohyoid muscle. And here we are holding one muscle which is known as the posterior belly of the digastric. So here we have a triangle that is made up of the sternocleidomastoid posteriorly, the superior belly of the omohyoid muscle antero-inferiorly, and the posterior belly of the digastric, the antero-superior margin. So this particular triangle is the carotid triangle. In the carotid triangle, there are a few superficial structures which are present on the superficial surface of the carotid sheath. So this is the carotid sheath. So we have removed the sheath, or we have actually cut through the sheath to find the structures inside. So this structure, that is the ansa cervicalis, was present on the anterior aspect of the carotid sheath. Now, as we have cut through the carotid sheath, let's identify the structures here. So one of the structure that is very easily identifiable is this structure, which is known as the common carotid artery. As we go cranially, at the level of the C4 vertebra, this will divide into an external carotid that lies anteriorly and a bit medially, whereas another structure that is known as the internal carotid, which lies a bit posteriorly and laterally. Now, if we just pull them a bit medially, one nerve peeps out. This particular nerve that is peeping out of this place is my 10th nerve, that is the vagus nerve. Okay, so this was a content of the carotid sheath, which has got an anterior wall formed by the pretracheal fascia and a posterior wall formed by the prevertebral fascia, and it contains this carotid with the internal carotid, the vagus posteriorly, and the lateral structure is basically this one, which is the internal jugular vein. Okay, so that's about the entire carotid region. Now if we go here, we are seeing this is the posterior belly of the digastric, and we know that this is the anterior belly of digastric, both of them having a different nerve supply for obvious reasons of development. Now, superior to the posterior belly of digastric tendon, here lies another muscle which is the stylohyoid. This one comes from the styloid process, and definitely it has got a different nerve supply as that of our anterior belly of digastric. So this particular triangle bounded by anterior belly of digastric, posterior belly of digastric with the stylohyoid and the margin of the mandible or the base of the mandible here is my submandibular triangle or the digastric triangle. Definitely the content has been removed, that is the submandibular group of lymph nodes, the submandibular gland. Then we have, this is the facial artery, so a loop of the facial artery is actually present here. And definitely one other structure that is present here is the hypoglossal nerve. So here is the hypoglossal nerve. So here is the hypoglossal nerve, which was primarily present somewhere deep to it, but it is supposed to go and supply the tongue. So this one is the hypoglossal nerves, giving motor supply to the muscles of the tongue.